Hey guys, it's good to see you. Coming to you with breaking news. There's been some changes in terms of what the CDC is saying that we need to do following exposure or infection with COVID. We're talking about specifically changes to quarantine and isolation. That's right. I'm going to give you the nuts and the bolts. I'm going to let you know what you need to know because, guys, this really is important. It's all over the news waves. And the other thing, too, is it's probably going to affect all of us in some way, shape, or form because, as you've heard me say, I do think that we are all at some point going to be exposed to COVID. Whether we all get infected with COVID depends on a number of variables, from our public health measures to how well our vaccines work, to how well our natural immunity works, to the levels of spread in our communities, right? There's a lot of things involved in that. But we do know that many people are getting infected with COVID. So this is likely going to affect all of us because it's going to change perhaps what you need to do following an exposure or an infection, say in terms of your work, also in terms of, your social life, your personal life, what you're able to do there. And then, so this is very important. So let me just go through what the CDC is saying, all right? First of all, I wanted to remind us the difference between quarantine and isolation. I think sometimes we use those interchangeably, and I have to admit that I have fallen prey to this. I know that I sometimes do this, and I'm not thinking specifically about the definitions, but isolation and quarantine are very different. Isolation refers to what we do after we have a confirmed infection. If I come down with COVID, when I go into my apartment, I stay away from others, I am isolating. Isolation happens after a confirmed infection. Quarantine, however, even though the behavior is not different, it's regarding a different situation. So quarantine means, yes, you are away from others, just like in the isolation situation, but quarantine refers to the period of time after you've been exposed to somebody with COVID or you have a close contact. You understand? You see what the difference is there? If I have COVID, I'm going to isolate. However, if I've just been exposed to someone or I have a close contact, then I'm simply going to quarantine. What we do during those periods is no different, but we call it something different, okay? So I need to be very clear about that, and honestly, in my videos and stuff with you guys, I don't always sort of use the strict definition, but understand that it exists. Let's talk about what the CDC said today. Again, all over the airwaves. We know that COVID cases are literally on the rise. We know that, by the way, a lot of what's happening in our world right now is being affected by this. The workforce is being affected. Airlines are being affected. Sports teams are being affected by COVID. Games are being canceled. Flights are being canceled. There are hospital systems with literally hundreds of workers that are not on the job helping other people and taking care of other patients because of what's going on. So what the CDC says is, and I've got my notes here if you see me looking down, it says, given what we currently know about COVID-19 and Omicron in particular, this is according to the CDC is shortening the recommended time from isolation. Now, this is what they're doing. If you have COVID-19, this is what is changing, okay? If you have COVID-19, your isolation period is no longer 10 days, but rather it is decreasing from 10 days to 5 days if you have no symptoms, okay? So if you have COVID, you have no symptoms, you're asymptomatic, instead of isolating, because remember we isolate when we have COVID, instead of isolating for 10 days, you can now isolate for 5 days. And then for 5 additional days, those, totaling 10 days, but the 5 additional days, you must wear a mask when you're around others. I would argue, to be honest with you, I would say you should be wearing a mask when you're around others anyway. People that are not in your household, rather. I know many states do not have laws requiring this. My parents live in Tennessee, and they live in Nashville, and when they go to the store and stuff, most people they see are not masked. Where I live in Philadelphia, it is a law and people are masked up. Regardless of what your government does, I recommend that you be masking up given Omicron, by the way, okay? So just to reiterate, CDC is shortening the time of isolation from 10 days for people with COVID to 5 days if you don't have symptoms. And then you follow that up with 5 days of wearing a mask when around others. So again, I argue you should be wearing a mask anyway, okay? Now, what they say is that The reason why the CDC is doing this is they say that science has demonstrated that the majority of COVID transmission actually occurs early in the course of the illness. So, in other words, we're most infectious and we're most able to spread COVID actually 1 to 2 days before we get symptoms and in the first couple days of being sick, which is why they say that, look, if you test positive, isolate for 5 days, but if you don't have symptoms at that time, then you can leave isolation, just continue to mask for 5 days when you're out in public to minimize the risk of infecting other people. Like I said, I think you should be masking when you're outside your house anyway. Now, let me explain what they're recommending for quarantine, because a lot of what's on the news right now is just the focus on the change in isolation, okay? And by the way, this is also going to help a lot of workplaces, these airlines, schools, doctors' offices, sports teams, you name it. This is a big change. If you don't have to be sitting out on the bench for 10 days, you can actually go back into play, or you can go back into work, or you can start flying that plane after 5 days or whatever, and you just have to wear a mask. That actually could change the game for a lot of things, okay? So we may hopefully at least feel some positive impacts from that standpoint. Now, the other thing that you're not hearing a lot of on the news is how the CDC has updated the recommendations for quarantine. Remember, quarantine happens when we are exposed to COVID. Isolation happens when we have COVID. We still do the same things. We still kind of, stay away from others, etc. But quarantine is when we're exposed to COVID. So what the CDC says about this is that for people who are unvaccinated or are more than 6 months out from their second mRNA vaccine dose, that's Pfizer or Moderna, or more than 2 months after their J&J, and they're not boosted, the CDC now recommends quarantining for 5 days, followed by strict mask use for an additional 5 days. So in other words, if you are not fully vaccinated, okay, if you're not fully vaccinated or you are unvaccinated, or you are more than 6 months out from your second vaccine and you're not boosted, kind of those situations, you can quarantine for 5 days, followed by mask use for 5 days afterwards, which again, I recommend you be wearing a mask anyway. And then, let's see here, they give some alternatives for that, but I want to just sort of stick to the basics. Hold on. Oh, okay, this is the next part I wanted to read. So they have an alternative to that if you're not able to do 5-day quarantine, but I don't want to get all confusing, because I know every time a patient calls me, or I'm calling them saying you're COVID positive, or they call me saying they're COVID positive, I literally have to look up these guidelines. Even though I do this every single day, I talk to you guys about this every day, I literally have to look up the guidelines every patient, because it is very dense. So if you feel like this is very dense and maybe mildly confusing, it's okay. You're not alone. That's why I'm reading this myself. Let us help you. Let your doctor help you. You don't have to know what this is. Just know that there is a thing that you need to know about so we can help you. So, but the other thing I want you to know though is that was for people who are not fully vaccinated or not boosted, okay? 5 days quarantine followed by strict mask use for 5 days. This is the thing. If you have gotten your booster shot, meaning you've gotten both Moderna and Pfizer plus a booster, or J&J plus a booster, you do not need to quarantine following a COVID exposure, but you should wear your mask for 10 days after the exposure. All right, so what's the long and the short here? The long and the short here is that quarantine and isolation have been cut down. They're shorter, they've been cut down than what they have been. It's no longer 10 days of isolation that you're out of commission if you get COVID, as long as you're asymptomatic at a certain point, and honestly. So that's going to change the game. And then of course, if you are fully vaccinated with the booster, you do not need to quarantine if you've been exposed to someone. Don't worry if all this seems super confusing. We will help you through it. Just know that there's been a big change. What I want to know is what you think about these guidelines. What do you think about the guidelines being changed? There are some healthcare providers that feel like this is short-changing what we need to be doing, and may not be the safest. There are many other healthcare providers who think that this is the safest, and why didn't we do this sooner? Whether you're a doctor or a healthcare provider or not, I want to know what you think. Do you think, how does this feel to you? Are you relieved? Are you not relieved? Are you afraid? Are you worried? Do you feel like, great, we can get back to things a little bit quicker? Let me know what you think. There is no wrong answer, by the way. By the way, I just want to thank everybody for being on this live. I know it's quick and short, but I wanted to come on and give you this breaking news. Thank you for everybody who's sending stars. I so appreciate you. You know I do daily health videos. By the way, if you're new to me, I'm Dr. Jen. I'm a practicing family physician and on-air health expert and video creator. Please like and follow my page. Those of you on YouTube, please subscribe to my channel and click the little bell for updates. As always, I will keep you updated with new updates. Again, let me know what you think in the comments. Guys, I'm Dr. Jen. I'll be back soon.